The hospitalization rate among pregnant women certainly on the minds of a lot of people right now, because it can certainly turn what would be a very happy time to a very dangerous time if those women get COVID-19. This morning we're joined by Dr. Matthew Sims of Beaumont Hospital. He's Director of Infectious Disease Research. Dr. Sims, thank you so much for joining us this morning.
Happy to be here.
Now, you've seen a growing number of expecting mothers being infected with the coronavirus turning up at your hospitals, 18 in all. What are the special challenges posed by treating these women, and what's your message to expectant moms?
Sure. So, in terms of treating the women, the treatments are the same. Steroids, remdesivir for people who need oxygen, and then we have some other medications down the line. But if they have higher rates of complication, they have a higher risk to have worse outcomes with coronavirus. So often they head to C-section, and that can be very early sometimes, as the story you mentioned earlier.
And of course, you're really treating two patients. You're treating the mom and the baby. Does that pose any additional considerations here?
We're always worried that the baby themselves can become infected also, especially after delivery. So there's definitely a lot of considerations. It's always stressful when you're treating a pregnant patient because you're worried about two people at the same time. And it's a very delicate situation. So whenever you have a pregnant woman, especially now with coronavirus, we are highly concerned.
Well, let's jump to hospitalizations. They're spiking across the state. Some facilities are at or near capacity. What are you guys seeing at Beaumont, and what's your message as we still struggle to contain the virus?
So we have a lot of patients at Beaumont. We're higher in hospitalizations than the last surge. We're not quite up to where we were back in March, April of last year, but it's still getting higher. And it's very concerning. We only, as I said, we have a few medications we have to treat this with. We don't have a magic bullet. I don't have, the equivalent of penicillin for, a simple infection. We have treatments that help, but, they don't give us like a 90% cure rate. They help by like 30, 40%.
All right, Dr. Matthew Sims, Director of Infectious Disease Research at Beaumont Hospitals. Thank you so much for joining us this morning, Dr. Sims. Really appreciate your insight.
I'm glad I was able to be here.